Hello friends, this is Sonu and today I am going to discuss about opioid analgesic. First of all, opioid drug which produce analgesic action. That's why the name is opioid analgesic. So first of all, what is the analgesic? As we know that analgesic they prevent or stop the pain. So we should know about little bit at least definition of the pain means analgesia. So what is the pain? First of all, pain it is the we can say the unpleasant sensation which can be acute or it can be chronic. It is evoked by the external and internal stimulation. So about the pain, because it's a we can say painkiller drug which prevent or stop the pain. That's why we should know about the little bit about pain. So pain it is the we can say uh, unpleasant sensation can be acute and chronic, usually evoked by external and internal stimulation. So this is about the definition of the pain. As we know that the different types of pain are there in the body, but according to etiology we have two types of pain. First, I mean the we can say the pathway of the pain. So nociceptive, and the second one neuropathic. Approximately 80% of pain in the usually generated by the nociceptive stimulation. Nociceptive means the stimulation of the noxus into the action potential. So this pain can be injury, tissue injury, or inflammation due to inflammation, and mostly this pain are belong to the acute pain, most probably acute pain. But neuropathic it's mostly the chronic pain. For example, due to the cancer, due to the malignancy, the cancer pain. So in these conditions we can say it's a neuropathic pain, or it's produced by the we can say it's a chronic pain. So opioid analgesic help mostly help the neuropathic pain, or we can say chronic pain. About the nociceptive pain, by the opioid analgesic, this pain also prevent or stop the by the help of the opioid analgesic. But in these conditions mostly we use non-opioid, that is a non-steroid anti-inflammatory drug. 90%, or we can say most probably use in this condition non-steroid anti-inflammatory drug or non-opioid drug, which is discussed after the in a next session we will discuss non-opioid drug. But in a neuropathic condition and some other pain, we can use or by the help of the opioid analgesic, it is we can say prevent or stop the pain. So these are the about little bit information about the pain. That neuropathic pain it's mostly belong to the chronic pain, and the nociceptive pain it is the like tissue injury, inflammation, and some other external or internal stimulus. So by the help of opioid analgesic we can treat the both pain. Now let's discuss about the opioid. What is the opioid first of all? So opioid it is the natural, semi-synthetic or synthetic compound which act on the opioid receptor and produce morphine-like effect. So it is the natural, semi-synthetic and synthetic compound or molecule which act on opioid receptor and produce morphine like effect. Why the morphine like effect are included in the definition? First of all, you should know that morphine, it's a very popular molecule or very popular substance. That so whatever effects of the morphine effect, whenever the person will take morphine, whatever effect will be create or will be seen in the person who take the morphine, the same effect will be seen whenever use the opioid analgesic. That's why we can say, for the understanding purpose, if we know that what is the main effect of the morphine effect, so we can understand that the same effect will be when we will person will take or patient will take opioid analgesic. Even the morphine, it's also included in the classification of the opioid analgesic. But nowadays we don't use morphine very we can say popularly, because as we know that it's a drug abuser. The person this take like a drug abuser, like drug, and for example like the alcohol abuser, the same thing. Morphine will take as a drug abuser. That's why this is a very popular effect, and all person will know that which types of effect will be generated or will be seen, will be appear in the person who will take morphine, and the same effect the opioid analgesic drug. So it is natural, semi-synthetic and synthetic compound which act on the opioid receptor and produce morphine-like effects. Now we'll discuss the opioid receptor. First of all, what is the opioid receptor? Because almost the opioid analgesic drug which act on the receptor. That's why very important to know about the receptor. So let's discuss about the receptor. Opioid receptor. Opioid receptor is divided into two parts: classic and non-classic. Classic and non-classic. In classic, three types of receptor is there. First, mu receptor. Second, delta receptor. And the third one, that is the kappa receptor. Kappa receptor. And the non-classic, it has opioid receptor like one, and sometimes we can say or nociceptive or fine FQ receptor, or fannin FQ receptor, or fannin FQ receptor. So opioid receptor is subdivided into classic, non-classic. In classic we have mu, delta, and kappa. And the next one, that is non-classic. Actually this receptor is not for the very useful, and recently they find that this receptor also present in the body, and the effect like a opioid receptor, it act on the opioid receptor. So that's why this receptor also we should know. But 80% or we can say approximately 100% of drug which act on the mu receptor, delta receptor, and kappa receptor, most probably drug which act on this receptor. About this receptor for the clinical use, we are not very useful to know. So let's discuss about individually about the receptor. First of all, the all receptor, this is the G couple protein receptor. G couple protein receptor. A lot of receptor are belong to the G couple protein receptor. Even the catecholamine, as we know, that androgenic receptor also belong to the G couple protein receptor. It's the same thing here. And G couple protein receptor is divided into G stimulatory and G inhibitory. So this receptor is inhibitory receptor. G inhibitory. It coupled with inside the internal the internal area of the cell or internal area of the receptor, that is the G inhibitory receptor coupled with the G inhibitory receptor. So let's the all three receptor with G couple protein receptor, that is G inhibitory receptor. So let's discuss that how in secondary messenger how it will be act or how it produce the function. Then we'll discuss individually function of the receptor, the main physiological function of the receptor. So, opioid receptor. For example, this is the cell. And this receptor, it is the 7-path receptor because it's a G protein couple receptor. So 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. So mu, kappa and delta receptor. These three receptors are binding here. This is the external area and this is the internal area. So you can understand here. Here it's a bind G couple protein. So as I said that it's an inhibitory receptor, so bind to the G inhibitory. G inhibitory further stimulate adenylyl cyclase. I'm talking about first the normal, then we will discuss that how it's inhibit. So G just forget about now I. G receptor, G couple receptor stimulate adenylyl cyclase, and adenylyl cyclase by the help of ATP, it's further stimulate cyclic adenosine monophosphate, and then cyclic adenosine further will protein kinase A. And as we know that cyclic adenosine monophosphate and protein kinase A will further help to the phosphorylation. It go in a inside the cell have endoplasmic reticulum, so it go and synthesize the calcium and then secrete the calcium. So this function, the normal function. But whenever G inhibitory protein will stimulate, means this G inhibitory protein further inhibit the adenylyl cyclase. And whenever adenylyl cyclase will be inhibit, means the ATP formation will be inhibit or interrupt. So cyclic adenosine monophosphate will be not stimulate or not will be it's not will be produced, and then further protein kinase also will be inhibit. So they all we can say secondary messenger function become inhibit, and whenever protein kinase A or cyclic adenosine monophosphate will be inhibit or will be interrupt, the normal function will be the interrupt due to G inhibitory. So protein kinase A will be open the calcium channel, potassium channel, and the potassium is a very rich amount in the intracellular than extracellular. So it will go from the intra to extra because a very high amount. So potassium channel will be go outside. Then it's decrease the influx of the calcium due to the cyclic adenosine monophosphate will be the inhibit. Then it's decrease the calcium influx. So first from the protein kinase A, it's due to the inhibition of the protein kinase A, it's open the calcium channel and cell become too much electronegative, and then finally cell become hyperpolarized. So due to excessive electronegative, hyperpolarized, cell become hyperpolarized. Next, it's decrease the calcium influx. And eventually the hyperpolarization of the neuron and the decrease the neurotransmitter release, means because it's a analgesic receptor, means the within the, because some of the pain will automatically disappear without any taking the medicine. How? The same thing, because this receptor become stimulate, and the where the pain is going on, that particular area, the nerve become hyperpolarized and pain automatically become disappear. It is a physiological condition. Without any medicine, the pain automatically disappear by this way, because the receptor is inhibit or hyperpolarized of the nerve area where the pain is going on, and eventually the pain become disappear. So by the same thing, by the same way, drug also act, because drug is we can say that it's enhance the physiological conditions or interrupt the physiological condition, then the drug show the action by this way. That's why we should know the normal function of the everything about the nerve, about the some other changes of the body, then we can decide that how drug will be act. But if you don't know the normal function, then we can't understand pharmacology at all. So these are the receptor, these three receptor, how it's act. Now we'll discuss individually receptor, that what is the localization and what is the physiological function. So let's start mu, kappa, and finally delta. First we will discuss localization. Location and action. So first, mu receptor. First, its localization is the spinal cord. Then thalamus. After that, brain cortex. Then brain stem. That is the medulla oblongata. Then energetic tract. So these are the mu receptor location, and some other location also, but this is the main location. And what could be the action? First of all, a spinal and supraspinal analgesia. So whenever stimulate the mu receptor, it's produce action, that is the spinal and supraspinal analgesia. First. Second, constipation are seen. constipation. Constipation, why? Because it's decrease the GIT mortality. That's why constipation. So decrease the GIT mortality. Then very important action, that is a physical dependence. Physical dependence. Then in some time peripheral vasodilation. Then euphoria. Actually the mu receptor is subdivided into three parts: mu1, mu2 and mu3. So mu1, in mu1 we can say in mu1 receptor just we can say physical dependence. Physical dependence, and mu3 has peripheral vasodilation. But the physical dependence is common. It's in a mu1, mu2 and mu3. In three subtype, the physical dependence you can see, and the spinal, supraspinal analgesia. And the most effect are in mu2 receptor. Mu2 receptor. So common is the physical dependence is a common in three receptor: spinal and supraspinal analgesia. Of obviously it's a opioid analgesic, so it should be there. So this three receptor has supraspinal anesthesia. Constipation also in a common for the three, and some other like peripheral vasodilation only seen in the mu receptor, and other two receptor is not seen. So these are the main location and the main action. Some different action can be seen in some patient, but this is the very common, we can say, action. Next, kappa receptor. Kappa receptor in limbic system. Then it's also present on brain cortex and periaqueductal gyrage. Periaqueductal gyrage, or we can say central gyrage. Central gyrage. Actually, these are the pre-optic area of the hypothalamus, and this central gyrage also present in the mu receptor. So I forget to write central gyrage or pre-aqueductal gyrage. Then limbic system, brain cortex, and in hypothalamus, then brainstem, and as well as GIT also. So effects, what could be the effect? First effect, that is the same as said, spinal and supraspinal analgesia. A spinal and supraspinal analgesia. Then the same constipation, sedation, sometimes behavior effect due to limbic system. Then euphoria. Then it's decrease the ADH. So we can say diuresis can be occur because decrease the ADS, so decrease the water reabsorption in the convoluted tubule and finally lead to the polyuria or diuresis. So diuresis can be, and dissociated hallucinations, dissociated hallucination. Are seen. So this effect whenever the kappa receptor will stimulate, this is the location and this is the physiological action we'll see. And the last one, that is the delta receptor. Its localization is the olfactory area. Olfactory area, then brain cortex, pontine nuclei, that's the part of the pons, then nucleus accumbens, that is the nucleus, and also in amygdala. We should write here. That is the amygdala. Amygdala. Amygdala also common in the we can say in 3 receptor. Amygdala. Here also amygdala. And these 3. And the effect will be in the delta receptor, not much effect, but first of all the common, that is the spinal and supraspinal analgesia. Then decreased GIT motility that lead to the constipation, and physical dependence that are common in here also. Physical dependence and behavior change, and I think there is no much action, but these are the action. So you can see that a spinal and supraspinal analgesia are common in 3 receptor. Then physical dependence also common in the 3 receptor. Constipation also common in the 3 of the receptor. Some euphoria and behavior effects, diuresis are seen in the kappa receptor. In a mu receptor, peripheral vasodilation. Euphoria also seen in this we can say receptor. So the basic and useful that we have to know, that is the spinal and supraspinal analgesia. That by this drug eventually we should stop or we should normalize the pain in the human body or in the patient, a person that was going to in the body is going on a pain. So that's why this action we should know. This about the localization is very not important to know, like of course if all information we know, that is very good, but for the clinical purpose or for the as a pharmacological view, we should know about the main action, that is the spinal and supraspinal analgesia constipation, then we can decide or we can understand of the drug indication and the side effect. If the side effect, if we will increase the dose of the opioid analgesic, then this action automatically will be increased. Means constipation will be increased, physical dependence will be increased, euphoria can be seen, ADH decrease. So this effect can be seen. Means if we know that physiological function at least, then we can understand that what could be the side effects if we use prolonged use, or what could be the indication. So this is our main, we can say, main information that we should rather we have to know, then we can understand about everything about the drug mechanism of action. Now we have to discuss another receptor that is the not very important but we should know. So now we'll discuss opioid receptor like 1 or nociceptin or orphanin FQ receptor. The localization of this receptor localized in a brain and spinal cord. In a brain, like in cortex, or in, we can say, brainstem, hypothalamus, and some other area, but this is the main. And about the spinal cord, it's found in the spinal cord. The action become, what could be the action? Actually, it is associated with the some biological changes such as the memory process, the kidney functions, the cardiovascular functions, and some other functions, and some CNS function as well as. So in CNS function, what could be the physiological action? It can be the anxiety and memory process, then renal process, cardiovascular system, we can say function, and some other functions will be. So as I said that about this receptor, that recently the researcher find that this receptor also include in the opioid receptor, but this is the non-classic receptor, means this is not typical receptor. Whatever the drug which belong to the opioid analgesic, this drug will not act on this receptor. Mostly those drugs will act on the kappa, mu, and delta receptor. That's why this is a classic receptor, and that's why we should know about that receptor very carefully. About this receptor, as I said that it's localized in the brain, in brainstem, in hypothalamus, and some other brain cortex area, in the spinal cord as well as also. So the physiological effect will be generated, that is the anxiety. It's helped, or we can say in the memory process, it's act in a memory process, in a renal process, like in a renal function, in cardiovascular system, and some other functions. So this thing about this all information about the receptors, the about the, we can say, main introduction about the opioid analgesic. By the help of this information, now we can understand that drug, how will be the act, and in which conditions we can use the drug, and what could be the, we can say, the indication. So in the next session we will discuss about the classification, about the everything about the drug, and also we will discuss about the poisoning, if, because it's all you can see that physical dependence means the person will take very high, or we can say because if it's a physical dependence, so as a abuser, drug abuser can be used if person will be in a go in a physical dependence. That's why we should know about the toxic antagonist, or we can say that antidote, that if the person will take too much opioid drug, then what could be the antidote, then we can save the life, or we can protect by the poisoning of this. So about this drug. So hope you will understand about the introduction. In the next session we will try to very soon discuss about the drug name and all thing about the pharmacology. Thank you so much.